Now let's get down to it. I need to vent a little bit, okay? I do need to vent because I am very upset today. I'm going to explain why. As you guys know, I moved from the state of Connecticut to the state of Washington in late June. So I've been here for about a month and a half now. And I'm going to be honest, I'm starting to settle in. It's feeling like home. It really is. The only things that we really have left over is to register my car, to get my my dresser set delivered. So there's a few odds and ends here that haven't been taken care of yet that still need to be completed for me to say, okay, I'm here 100%, I've got all my stuff in line, you know what I mean? There's still a few things missing. And one of the things that have been missing is that I haven't gotten any of my information regarding my new healthcare plan here in the state of Washington. So let me explain what happened. I had healthcare, an individual healthcare plan, they call it a solo plan, in Connecticut through a company called Connecticut. Okay, and it was very expensive. It was an individual healthcare plan that I paid for myself out of pocket. It's not like I worked for a company that pays for it for me or anything. I literally pay for it, and it's hundreds and hundreds of dollars a month. When I moved to the state of Washington, basically I looked it up on their website, and the healthcare plan said, well, technically you're still covered. There's no requirement that says when you leave the state of Connecticut that you can't be covered by them, but they're not going to pay for the majority of stuff because they have what's considered in-network and out-of-network medical care providers. So anyone outside of Connecticut is considered out-of-network, and basically they pay very little of anything that those people will charge me. So for example, right now, if I were to get sick and I went to a doctor here in Washington State, Connecticut would cover me, but only a very limited amount. So maybe if it was in Connecticut, they'd pay 80% of the doctor visit. Here, they'd probably pay 10%. So literally, it would be like a waste of time for me to continue having this health care because they're not going to pay much stuff for me at all. All right? Now, what I need to explain to you guys is that very recently, in fact, it was the past year, due to President Obama's, what they call Obamacare, it was this new health care initiative where he felt that every American should be covered, that no American, just because they're poor, should be denied health care, that no American, because they're sick and have a pre-existing condition, should be denied health care. So he changed all of the rules, the regulations, and the laws regarding health care. But what he also did is he changed the entire infrastructure of how you get health insurance. It used to be that when you, for example, if the previous system, I moved to the state of Washington, I would just look up companies in Washington that cover you for health care. I would have contacted them individually. I would have gotten quotes from each company saying how much they would charge me each month, and I would pick whatever one I felt had the best coverage for the best price, and I would get it, okay? Now, the shortfalls of that old system were that, let's say I had something really bad with me. Let's say I had, okay, for example, let's say my back was even more seriously injured than it is. Let's say that my back was like, I was debilitating, right? I was in a wheelchair. There were certain healthcare companies that would say, well, because you're in a wheelchair, we already know that you're taking tons of medication, you're probably going to have ongoing surgeries, we're not going to cover you, deny. And that's what President Obama, had said that's not right. Just because you're hurt, why would you not get health care? That's insane. It's really because what we allowed to happen is we allowed medical care in the United States to turn into a business instead of a morality kind of thing. They turned it into big business, and big business says we can't make money off these people who are spending money all the time on the doctor, so just deny them all. And that's what was happening. It was horrible. So President Obama, with his, with what he was intending, actually had incredibly good intentions, and in all, overall, the changes that he's made to healthcare are helping tons of people who previously wouldn't even get the healthcare. So in that regard, great, okay? But with every positive choice and every positive change, unfortunately, comes a negative side. And unfortunately, what has happened is this. Now, because everyone qualifies for healthcare no matter what, due to this new government regulation, it is now all done through central agencies through each state. So now, instead of me going out to, say, 10 different healthcare providers, getting quotes, comparing them, and picking the one that I want, I have to go through the healthcare provider website for Washington State. So when I moved here in June, at the end of June, I went to this website, I provided all kinds of information, including my new address, my social security number, my previous coverage through this old Connecticut, company that I was going through. I give them all that info. They then gave me some options, similar to what I would have had to done previously. They gave me a list of companies, excuse me, who would cover me. I picked the one that I wanted, that I thought had the best coverage for the best price, okay? And I even went as far, they charged me. They charged me for the first month, which was hundreds and hundreds of dollars. I think it was over $300, if I remember correctly. It might have been even $400 for that first month's coverage. They charged me for it. I paid for it. Okay? They then said, okay, you're done. Your coverage will be going into effect as of August 1st. So as of August 1st, you will be covered by this new company. And, at that point, you'll be contacted by them. You'll get your health care card and all that stuff so that when you go out to the doctor, you give them your insurance card or whatever, and it gets covered. Okay? So here, as you guys know, the whole month of July, I was, thinking everything's good, no problems or nothing. I'm just going to wait till August, and I'm going to get all my health care stuff. Right? I'm covered. Technically, I should be covered as of August 1st. So if anything after August happens, I'll be able to get it paid by this company. And no issues will arise, right? Business as usual, working and everything. So here it is. It's August 7th. I'm like, wait a minute. I still don't have it. It's been a week. And that I've supposedly been covered by this company. They didn't mail me my health care cards. In fact, I didn't even get a piece of paperwork or an email from this company saying welcome or, confirming that I'm being covered. This is just so peculiar to me. Let me go out of my way, which, again, I shouldn't have to, right? This is a company who's in the business of making money. They should be contacting me, but no. I had to go out of my way to contact them and try to figure out what the hell's going on. So last night, I went onto the website, the Washington Healthcare website, and I found the number. I called them, and I said, what's going on? And they said, oh, no, sir, we see here in our records, yes, in late June you did register, you paid, and you are covered now. It is August. You are covered by this company. We don't know why you didn't get your health care cards, but you're going to have to call the company directly. So basically what happened is previously, before Obama changed everything, I would have already been dealing with the company directly. I would have talked to them. I would have known exactly what was going on. But because we now have everything centralized, I had to go through this third-party Washington State website who didn't give me any information. And now they say, okay, well, here's the number. Call them directly. I'm like, okay, fine. I'll call them directly. I'll try to figure this out. Okay? I call them directly. We don't have your information. We don't even know who you are. You're not in our system. We were never sent anything. We're not covering anything for you. So, obviously something went wrong here. And we get calls like this all the time. And, and we apologize. It's not our fault. It's that stupid Washington State website people. They don't do their job properly. They're not educated properly. And the website doesn't tell you what you need to do to actually qualify for health care. I'm like, you got to be shitting me. So I paid them money. I paid them money. And for a month, they literally just held my money, did nothing with it, and I don't have health care. And they said, no, you don't. But here's what you need to do. You need to get a letter from your old utility company in Connecticut. You need to get a letter from your new utility company here in Washington State. You also need to get a letter from your old health insurance company stating that you've canceled it so that we know that you don't have double dipping coverage. And then with those three pieces of information, the state of Washington should approve your stuff and send us your information, and then you'll be covered. And I said, why didn't they tell me this? It's just because they're horrible. They didn't train people to do this job. They rushed people into the new job to do this because Obama's plan went into effect so quickly that no one knows anything. So basically, they changed the whole healthcare system in America, but they didn't properly educate or train or equip anyone to handle it. Right? I'm like, this is amazing. So I called back the Washington State website, and I say, I just got off the phone with this healthcare provider who you said I was covered by. They said I'm not covered, and they told me all this stuff about stuff that you need. What is going on? And the guy goes, oh, I don't know. I'm looking here, and I can't see. Oh, let me put you on hold for a brief moment. He goes on hold. He comes back. Oh, sir, yeah, I'm very sorry. Yeah, we do need all that information from you. And I'm like, why didn't the website ask for it or tell me you needed it? I don't know, sir. I apologize. You know, this is a new system. We're getting set up. I'm like, so literally, I could have been sick. I could have gotten deathly ill this month. Went to the hospital, right? They would have billed me for everything, and nothing would have got paid because you fuckers don't know what you're doing. And the answer is yes. That is the answer. So anyway, all this is going on, and unfortunately, it's a pain in the ass because, again, is it eventually going to be something great? Yes. Eventually, once the system is finally worked out, once everything is easy, right, and they notify you properly, I'm sure this system is going to be great, and it's an amazingly great positive thing that people are getting healthcare coverage that they haven't had before. But the fact that people now have to go through all these fucking hoops, you've got different companies that aren't communicating, people that weren't trained, it's a joke. And this is life or death for some people. What about the person who moved to another state, got sick, and now they have to pay all those bills themselves and they can't afford it? What the fuck? So it's a stupid, broken system. Anyway, now what I have to do, I've canceled my coverage from Connecticut because they weren't going to pay for anything anyway. I've asked for them to expedite the process to send me a letter here to the state of Washington stating I'm not covered by them anymore. Once I have that, then I have to scan that in, and along with the 2 bills, submit that to this Washington state website, okay? Submit all that info. Then I have to get on Washington's ass to try to process that info. So they'll send that info over to my healthcare provider. So then they'll put me in their system and they'll send me the medical card. So we're probably talking 2 more months of work. So I really fucking hope I don't get sick in the next 2 months, because guess what? I doubt anyone will pay for it. It's going to come out of my pocket. And the worst part about all this is that I was really looking forward to going to the doctor, to getting a full medical checkup, to seeing how my health is, because I haven't done it in years. And who knows, I might have underlying health issues that I'm not aware of, and there's no way for me to check on that right now because I can't afford out of pocket. You know how much a doctor visit even is? Just to do a standard physical, it's hundreds and hundreds of dollars, and I can't afford it out of my pocket. So, it sucks, right? It sucks that this is the process, but that's what you have to go through if you don't work for like a company who has their own healthcare coverage through the company. You now have to go through all these hoops to get stuff done. And now, unfortunately, my health checkup is on indefinite hold until I get all this sorted out. And it could take months, because who knows how long it's going to take for this company to write me a letter, send me a letter, has to come through the mail, I have to scan it, I have to submit it, now another company has to check it, verify it, submit it, then another company has to put my information in, print out the cards. It's a joke. It's a joke. I would have been able to go just to this direct company if it weren't this big new process, right? It's pretty annoying. Alright, so that's why I'm late, everyone. I didn't mean or intend, obviously, to start this late. We're going to be doing about three solid hours of content on the stream tonight. Second stream is going to be Hate Live, my podcast. And boy, is there a lot to talk about. We've got game release dates that have been shifted around a bit. We've got huge, big company-changing, business-changing policies on Twitch TV that there is tons of controversy about right now on the internet. Rumors abound that it's the direct result of Google bidding to purchase Twitch. So there's lots of stuff going on, okay? And there you have it. Oh my god, I love the idiots who tweet me about this stuff now. Yes, I'm just gonna read this tweet. Yes, let's sacrifice human life for convenience. We don't even have a universal health care, you ignorant asshole. So basically you're an idiot, you read a tweet, you interpreted it how you wanted it, instead of understanding that I do like the fact that people are getting covered, people who hadn't been covered, before Obamacare, but it's the new process is just broken, and was not properly developed. But, you know, this is what people do. They tweet shit like that because they're fucking ignorant assholes. And, you know, they call me an ignorant asshole when they're just idiots who interpret things how they want instead of how they really are. If you'd actually listen to me on pre-stream today to hear my full thoughts on the matter instead of interpreting a tweet, maybe then, you know, you would have understood my real feelings, but you're just a jackass. And you'll be treated as such. So anyway, let's end the pre-stream, everyone, and let's get started. As I said, we'll have about 3 hours here of Devil May Cry HD 3, or 3 HD, sorry, I said that in the wrong order. And it will continue tomorrow as well, so don't worry. I know that today was kind of a screw-up here with everything going on. Tomorrow we will have it as well. So no worries there if you're, oh no, you know, now we're not going to see it again for a few days. Nope, we're going to have it tomorrow as well. Okay. Thanks to everybody. And let's end the pre-stream and get started.